the elbow joint is classified as which type of joint? A. Ball and socket. B. Hinge. C. Pivot. D. Saddle. Answer: B. Hinge. Explanation: the elbow joint is a hinge joint, allowing movement in one plane, primarily flexion and extension. This type of joint is formed by the articulation of the humerus, ulna, and radius. Which of the following ligaments stabilizes the medial side of the elbow joint? A. Radial collateral ligament. B. Ulnar collateral ligament. C. Annular ligament. D. Transverse humeral ligament. Answer: B. Ulnar collateral ligament. Explanation: the ulnar collateral ligament, UCL, stabilizes the medial side of the elbow. It is crucial in preventing excessive valgus stress, which could otherwise damage the joint. The humerulnar joint is formed between which two structures? A. Humerus and radius. B. Radius and ulna. C. Humerus and ulna. D. Radius and scaphoid. Answer: C. Humerus and ulna. Explanation: the humerulnar joint is the primary articulation at the elbow, formed between the trochlea of the humerus and the trochlear notch of the ulna. This joint allows flexion and extension of the forearm. Which of the following movements is allowed at the elbow joint? A. Abduction and adduction. B. Pronation and supination. C. Flexion and extension. D. Rotation and circumduction. Answer: C. Flexion and extension. Explanation: the elbow joint is primarily a hinge joint, permitting flexion, bending, and extension, straightening, of the forearm. Pronation and supination occur at the radioulnar joints. The annular ligament surrounds which part of the elbow joint? A. Radial head. B. Olecranon process. C. Coronoid process. D. Capitulum of the humerus. Answer: A. Radial head. Explanation: the annular ligament surrounds the head of the radius and holds it in place, allowing for rotational movement of the radius during pronation and supination. The carrying angle of the elbow joint refers to A. The degree of flexion in the elbow. B. The alignment of the humerus and ulna during extension. C. The angle formed between the forearm and the upper arm when the elbow is extended. D. The angle between the radial and ulnar bones in the forearm. Answer: C. The angle formed between the forearm and the upper arm when the elbow is extended. Explanation: the carrying angle is the normal valgus angle between the forearm and upper arm when the elbow is fully extended and the palm is facing forward. It is usually greater in females. Which part of the elbow joint is responsible for preventing hyperextension? A. Ulnar collateral ligament. B. Radial collateral ligament. C. Joint capsule. D. Bony configuration of the humerulnar joint. Answer: D. Bony configuration of the humerulnar joint. Explanation: the humerulnar joint has a bony block that prevents hyperextension. When the elbow is extended fully, the olecranon process of the ulna fits into the olecranon fossa of the humerus, limiting further extension. Which muscle is responsible for flexion at the elbow joint? A. Triceps brachii. B. Brachialis. C. Anconeus. D. Brachioradialis. Answer: B. Brachialis. Explanation: the brachialis muscle is the primary muscle responsible for flexion of the elbow joint. It lies beneath the biceps brachii and acts regardless of forearm position. The radial collateral ligament of the elbow joint stabilizes which side of the joint? A. Lateral side. B. Medial side. C. Anterior side. D. Posterior side. Answer: A. Lateral side. Explanation: the radial collateral ligament stabilizes the lateral side of the elbow joint, providing support to prevent excessive varus stress, inward angulation of the forearm. What is the primary function of the elbow joint? A. Allowing wrist movement. B. Allowing flexion and extension of the forearm. C. Providing rotation of the forearm. D. Stabilizing the shoulder. Answer: B. Allowing flexion and extension of the forearm. Explanation: the elbow joint's primary function is to allow flexion and extension of the forearm, facilitating a wide range of activities such as lifting, reaching, and throwing. Which of the following is the most common type of elbow dislocation? A. Posterior dislocation. B. Anterior dislocation. C. Lateral dislocation. D. Medial dislocation. Answer: A. Posterior dislocation. Explanation: posterior dislocations of the elbow are the most common, typically resulting from falls where the hand is extended and the elbow is forced backwards. Which of the following is not a component of the elbow joint? A. Humerus. B. Radius. C. Ulna. D. Scaphoid. Answer: D. Scaphoid. Explanation: the scaphoid is a carpal bone in the wrist and does not contribute to the elbow joint. The elbow joint is formed by the humerus, radius, and ulna. In which direction does the elbow joint primarily allow movement? A. Anterior-posterior. B. Lateral-medial. C. Rotational. D. Superior-inferior. Answer: A. Anterior-posterior. Explanation: the elbow joint primarily allows anterior-posterior movement, specifically flexion, bending, and extension, straightening. It does not allow significant lateral or rotational movement. Which of the following muscles is responsible for elbow extension? A. Brachialis. B. Biceps brachii. C. Triceps brachii. D. Pronator teres. Answer: C. Triceps brachii. Explanation: the triceps brachii is the primary muscle responsible for extension of the elbow joint. It acts when the forearm is straightened from a flexed position. Which of the following is true regarding the elbow joint capsule? A. It is a single-layered structure that encloses the entire joint. B. It is reinforced by the radial and ulnar collateral ligaments. C. It forms the only structural support for the elbow joint. D. It is not involved in joint movement. Answer: B. It is reinforced by the radial and ulnar collateral ligaments. Explanation: the elbow joint capsule is a fibrous structure that surrounds the joint. It is reinforced by the radial and ulnar collateral ligaments, which provide additional stability. The pulled elbow injury, also known as nursemaid's elbow, typically results from which action? A. Sudden traction on the extended arm. B. Forceful rotation of the forearm. C. Hyperextension of the elbow. D. Direct trauma to the elbow. Answer: A. Sudden traction on the extended arm. Explanation: nursemaid's elbow occurs when there is sudden traction, such as pulling, on the extended arm, causing the radial head to slip out of the annular ligament. This injury is common in young children. Which part of the elbow joint articulates with the radial head during pronation and supination? A. Olecranon process. B. Trochlea. C. Capitulum. D. Coronoid process. Answer: C. Capitulum. Explanation: the capitulum of the humerus articulates with the radial head, allowing for rotation of the radius during pronation and supination of the forearm. A fracture of the distal humerus may affect the function of which part of the elbow joint? A. Humerulnar joint. B. Proximal radioulnar joint. C. Humeroradial joint. D. Both the humerulnar and humeroradial joints. Answer: D. Both the humerulnar and humeroradial joints. Explanation: a fracture of the distal humerus could affect both the humerulnar joint, elbow flexion and extension, and the humeroradial joint, contribution to forearm movement, compromising the overall function of the elbow joint. Which of the following movements can cause injury to the ulnar collateral ligament of the elbow? A. Excessive flexion of the elbow. B. Forceful pronation of the forearm. C. Repetitive throwing motions in baseball. D. Hyperextension of the elbow. Answer: C. Repetitive throwing motions in baseball. Explanation: repetitive throwing motions, especially in sports like baseball, can place excessive valgus stress on the elbow, leading to injury of the ulnar collateral ligament, UCL, which is vital for stabilizing the medial side of the elbow. Which of the following structures prevents the radius from dislocating at the elbow joint? A. Annular ligament. B. Radial collateral ligament. C. Ulnar collateral ligament. D. Joint capsule. Answer: A. Annular ligament. Explanation: the annular ligament surrounds the head of the radius and holds it in place at the proximal radio-ulnar joint, preventing dislocation and allowing for rotational movements of the forearm.